Hello everyone and welcome to our episode today. Welcoming you from home, wherever you are, in a taxi, in a car, in the office, in the comfort of your bedroom or your dining area. Welcome to our episode today. It's our 10th episode. I'm your host Kedibone Sekgethela and I'm not alone today. I'm joined by this beautiful lady who will introduce herself. Thank you so much for joining me today, as we will be discussing a topic that is affecting a lot of people, and most of the people misunderstand it. And we touched it on our previous episode, which is Alzheimer, when we hosted Dr. Mohase, and today we are now going to share a give or allow or someone wanting to know more, understand more about the Alzheimer or the mental illness, please join us on this conversation and be that this conversation is for you. And we will explore just the challenges and also the strength, resilience, and the hope that surrounding this journey. And let's dive in. Ladies and gentlemen, my day, Dr. Vuyiswa Mabita.
Looking for it?
Yes. Honoring the previous episode, we had a gentleman by the name of Dr. Vuyiswa, and he's the mother that knows things. Just go back from a child perspective. Could you please introduce yourself so that people know that to whom they will take it from there.
Thank you very much. So as you've said, my name is Vuyiswa Mabita. So I'm a neurologist. Basically means that you're a doctor specialized in neurology. So dementia, diseases that we treat as neurologists.
Maybe let's just down Okuti. Where is it come from? When they've got dementia or Alzheimer's, where is it coming from? What is it?
Yeah. So dementia is it's an overarch, diagnosis. So it's one of the dementias that people get. So simply put, dementia is basically a disease of cognition. Cognition meaning the functioning of the mind, right? Where it deteriorates. And we only diagnose it if symptoms have come up for 6 months or more. Because less than that, it doesn't qualify as dementia. Because when you diagnose something like dementia, where it's irreversible, incurable, you have to make sure that it's not being caused by something we can fix. So there are certain things that cause what we call a pseudo-dementia, like vitamin B12 deficiency, for instance. So that's something we can treat. So that's something we need to look at before we diagnose. But speaking of dementia, so that's the minimum time of symptoms has to be 6 months. And symptoms are forgetfulness, and then as well as just higher functioning in terms of things like, arithmetic that is usually simple for us, right? Or you find a person starting to forget important things like things to do with their finances, for instance, that they would ordinarily, or, I know sometimes, we things like password things, but if it's a PIN number of your card that you use all the time, and then suddenly you don't know it, that kind of difficulty. But then it also has what we call the visual spatial aspect to it, where a person is no longer sort of knowing where they are, in space, things that would be easy to recall. So it's that kind of forgetfulness being more evident to us, but it's also processing of your mental thoughts, and something called judgment insight. And by judgment, things like, an example that's made often is if you find a letter on the floor addressed to someone, what do you do with it?
Yeah.
So that response, it has to be a response that makes sense. So if it doesn't, it means you've lost judgment. Or things like if you see someone about to cross the road as a child, there's a car coming, what do you do? So if we don't get the answer where you say, I'll stop the child, then the judgment is part of, dementia. But also another thing is knowing. So the minute you know that they're wrong, then you've lost insight. So that thought process affects me. And with regards to the different types of dementia, there are certain things that strike out more in one versus the other, for instance. Yeah.
Sure. It's quite a complex thing. And now I'm sitting here and I'm like, okay, if there are so many aspects of it now, when you're speaking of cognitive alone, what are other factors that also affected when one has been diagnosed or when one is experiencing dementia?
Other aspects in terms of the symptoms?
The symptoms, yeah.
All the symptoms stem from cognitive abilities, right? And cognition just means having a systematic and logical way of thinking, right? So you find if I switch on the stove and walk away and then don't come and check, that's a memory issue, but that's also an issue of insight and judgment, So there are a lot of thought processes that go into you doing normal things. That when things are wrong cognitively, it's really, for instance, Alzheimer's as an example, it's the type of dementia where you'll have memory early on, and you'll have a lot of cognitive on. You'll hold 50 discharging something that your change is 40 rand. You know what I mean? So it's simple arithmetic, So you lose those kind of abilities. But there's a huge very spatial aspect to the dementias that cause things like, Gogo is out wandering around, or, they were sleeping at night, opened doors, and some people found her wherever, So that is something where visuospatially a person has lost a way of knowing where they are.
Yeah.
Yeah, so those are the things to look out for.
Speaking of that matter, Yoguti, Ukoko would now wake up in the middle of the night and wander around. What is the relation Alzheimer or dementia, darkness?
Okay, so with dementia, there's something we call sundowning effect. So with a lot of dementias, they get worse at the end of the day when the sun is down. So you find at night. So I think if you had to explain it logically, it's that visual spatial awareness is worse because gumnyama is stuck up there. But also just in general, we find that sundowning effect happens a lot with most of the dementias, right? So, common ones are obviously Alzheimer's, and we can go into that. But another thing to consider in our environment, especially with Black people, is avascular dementia. So that's a dementia that's derived from risk factors for a stroke.
Okay.
So if you have uncontrolled cholesterol, diabetes, hypertension, it's almost like you have a lot of mini strokes until that last one that now affects cognition, So that is something that we really need to talk about, where if you have those risk factors, they must always be under control, because one of the things that can happen is that you can find yourself with a cognitive abnormality that builds up over time.
Sure. And I was also not aware of this
Yeah, no,
And
absolutely.
I've learned now that we
Yeah.
need to make sure that those risk factors are monitored and are also taken care of
Sure.
to avoid the bigger thing
Ab-
coming.
Absolutely. The other thing that we speak of with dementia is that sometimes dementia is a part of a disease. So sometimes you get something like Parkinson's disease. Parkinson's disease, one of the elements that come later on is the cognitive aspect is dementia.
Yeah.
But now with all of these, if I can maybe take these three examples, like with Alzheimer's, certain features we know it develops around the 60s, because if we're talking to anything or any entity that's dementia-like in the higher, like in the 80s, then we'll say it's a senile dementia because it's of old age, right?
Okay.
And some people are predisposed more than others. Alzheimer's then will start like 20 years before that, in the 60s. And usually then, like I said, it will start with the cognitive, judgment, those things that make sense, it affects what we call semantic memory. So that is memory of place, time, person, So things like your date of birth, you remember it because it's something that is there in your semantic memory. So those things where a person now stops recognizing people, where you ask someone who's been married for 40 years what day they got married. You know what I mean? The things that really happen in your mind over time and you should rattle them off, Then the visual spatial getting lost, that happens. With regards to something that is secondary to a disease, like something like Parkinson's disease, the dementia comes later, and it's more of what we call, the initial thing to leave is what we call procedural memory. For instance, if you can drive, that memory is procedural, right? You get taught once or twice or whatever, then next thing you know, you drive, you're not thinking about it. So somebody who's been driving for a long time, if they have to think about what to do when they go into the car, then that's how. So those are the early things that come with something like Parkinson's disease, that monotonous thing of doing an action that you've always done. That goes first. Whereas with Alzheimer's, it's semantic memory, the facts. What's your address? When were you born? And what's so-and-so's name? Somebody who you've known for long, And then you get vascular dementia. That is a subset of, you can think of it as a subset of stroke. Because we say stroke is common, more common in black men over 50, right? And so that's one risk factor we can't do anything about. But then we have high blood pressure, we have the cholesterol, we have diabetes that are important. And if left untreated, they can give you a dementia. So for a long time, the dementia in our setting, in the black setting, the vascular dementia was more common. So now with frequent urbanization, Alzheimer's is becoming more common in our environment as well. But things like vascular dementia is a type of dementia you don't have to develop if you control your risk factors, right? So if you do actually do your BP checks, make sure it stays, you take your treatment, you look at your glucose and that kind of thing with diabetes, watch your diet, then you can avoid that dementia. Whereas things like Alzheimer's, if you're going to get it, it's predestined, it's genetic, then that you develop. But even after you develop a neurodegenerative disorder, there are drugs we give to slow it down, and there are ways in which to manage the disease, which we can speak about. But we just need to know that with a subset of dementias, you can actually help yourself to not get that.
So it's very important for our people or for us to regularly check ourselves, to regularly visit the doctor or the clinic in order for us to avoid the vascular
what we call vascular dementia.
That one is controllable.
Yeah, it is, and that one develops in a stepwise way, depending on whether you control your risk factors or not. Yeah.
Sure. So, guys at home, it's very important that we look after ourselves. We watch what we eat. We exercise regularly. If you are diagnosed with high blood pressure or glucose, please take your medication. Make sure that it is regulated so that we can avoid the stages where you get vascular dementia. Now, I need us to. We spoke about the risk factors. We spoke about identifying the person who's got the Alzheimer's or dementia. And I need to understand, what is the impact of the environment on Alzheimer's or dementia patients?
Oh, that is actually very lose is your visual spatial awareness. So knowing where you are. And sometimes we can help the person keep the environment as related. So if you are in the house that you've lived in for a long time, that visual spatial space actually helps if you don't change and go to this week you are staying with so-and-so and the next week you are there. So it's best to keep someone in an environment, especially when that visual spatial part has come in an environment that they know. Because you find a lot of people then develop anxiety or manifest worse sort of symptoms when you suddenly thrust them into a group of people or suddenly put them in an environment that is unfamiliar. So in terms of environment, that's very important. But also, that's one thing we need to look at is safety. So people with Alzheimer's, the sleep patterns are affected. So when you are sleeping, the person affected may wake up and walk out. So things like making sure you lock the doors and keep the keys, and watching out for the electronics. So if you make sure that you switch off the electronics so the person doesn't wake up, switch on stoves, open taps, then leave them running. There's, the house floods, those things. So one needs to go around their house and actually make sure that you've actually made it safer for that person should they be wandering alone in the house, So dementia starts off mild. So you start, initially you as a person with dementia are aware that your memory is declining, and some people sort of compensate for it in the beginning and write things down and all of that, because I think it's a diagnosis we're not always ready to face that kind of diagnosis. So people go into that initial phase where they make up for it so that they are aware of it, but they don't want everybody else to be. But what happens is if people present when it's mild, we have the chance to speak to everyone as a family as to plan for when the dementia progresses. We have the opportunity for the person to appoint someone to deal with their legal and financial matters when it gets there, and to plan for their care, And the other thing is that we need to understand is when somebody has developed dementia, we don't then give up on actually keeping their mind active. So we give drugs that slow down the progression, but it helps to keep that person active in something because it helps slow down the process. Because as you are engaging your brain, so if it's something simpler than what you were doing before, you have, a herb garden that you're growing, that kind of thing. And then investing in a routine. It also helps the visual spatial space. So if you keep their room in the same, things are in the same place. So when that person wakes up, they don't have a disorientation that is equal to waking up in a place you don't know, So it helps a bit to keep things where they are, but to have a routine, knowing that this is when you wake up, this is when you take your medication, have breakfast, whatever the case is, and sticking to it. So what we do is we take the diagnosis and then leave the person to just sit and not do. So if we can help it, we need to give that person a routine, because that helps actually engage other neurons that will then, sustain them. In that. So as much as we say Alzheimer's is what we call a neurodegenerative disorder, so that some of your brain cells are degenerating quicker than they ought to. But we can also engage the ones that are normal, so that we keep those tracts strong at that time, and it actually prolongs the progression.
Did you maybe can you maybe give us examples of the things that, or maybe the activities that the caregivers can use at home to make sure that they assist or they keep the minds of
the person
patients active? I read somewhere that chess helps. I don't know if it's scientifically proven.
So, chess is a very complicated game. So it engages a lot of your cognition when you do it. But the short answer to that is it depends on the stage of the dementia, right? So if you're in the early stages of dementia, things like doing, intense crossword puzzles and things that involve reading and comprehension, those kind of things you can still maintain, right? And so you need to find things. We also shouldn't make it like it's school, you know what I mean? So the person, it should be things that appeal to that person, they are of interest to them, So like I say, initially you can do things that require the chess, you can do crosswords, things that require a lot of your intellectual capabilities to be engaged. And the more you engage those pathways, the better, right? You keep them for longer, so to speak, right? But if you're going to mid and severe dementia, then it's different. Then the games that they would do, or what activities that they would do, would need to be less complicated. Because the thing is, the awareness of the dementia also is gradual. So how we deal with it can put someone in a depression, because they're aware of what's going on, right? So we need to keep the activities that they do. So for instance, if we're thinking it's a little bit more established, something like supervised gardening of a small space, if you know that this person that's what they love doing. If it's a person who's musical, you engage them in that space, right? And the things that, there's a part of the brain called the limbic system, which is our memory and emotions and all that. And that's why I stress that if it's something of interest to a person, then you engage them with something that they know that is the love of their life, or whatever the thing is. Then that way you keep that going for longer, So there are sometimes that cognitive exercises that you get from your occupational therapist, for instance. And so they can give you a sort of appropriate for the level of dementia, what activities the person should be having. But not everyone has access to an occupational therapist. So the simpler we make it, the better. So if the person still likes to bake, for instance, you help them do it until there's part where you put it in the stove and time it and that kind of thing. Gardening as another example. But the thing is, we need to make sure we engage people with dementia. And sometimes the smallest thing is good enough to engage them, but it must be part of their routine.
Sure. So it means it's important to know and understand the person. Absolutely. And also to engage them, to include them, not like having us normal households whereby a person who is diagnosed, we just leave them there, quiet and alone, and which triggers.
Then you put them in.
depression.
Yeah, absolutely.
So
Yeah.
we need to include them in our daily activities
Yes.
and find ways where we can accommodate them according to their level.
Yeah.
And you mentioned like something like not all of us is accessing or is accessible to the occupational therapist.
Yeah.
How often or how many of the patients that we have in public hospitals that actually get assisted?
It's different for different public hospitals. It depends how big the hospital is and what kind of resources they are, you know. We don't always have that access to an occupational therapist that one would have in the private sector. But even then, you know, it helps to have had a few or early sort of interaction with them, because then you are given the exercises, the cognitive exercises that you can do. But you don't necessarily have to do that, because, you know, when we speak of dementia and how it affects mental functioning, the spaces of intellectual functioning is different to the emotional space in the brain, the memories, the musical space. So if that is still intact, that would be a way in, to, you know, into engaging the brain. So when there's an intellectual inability, the cognition is gone, it means your higher function is gone, but it doesn't mean that you can't enjoy the music you've always enjoyed. It doesn't mean that, you know, if I bring out a recipe you used to use from your grandmother and you remember it off heart and you can do it. It doesn't mean, do you know what I mean? So it's this, things that are sentimental to you. There's a way of accessing the brain through that, you know? So there's a lot, as a caregiver or as a family, you need to know the person you're looking after, you know? And you know the best way to engage them, you know? But the main thing is, don't forget that somewhere in there, in the forgetfulness, is the person you know. And neglecting that can cause the depression, anxiety. I do a lot, because what a routine does is it creates the expectation from the brain to maintain a routine going. So it's because the brain expects it, you find it gets easier and easier to do it. You know, so it's important in that sense.
Sure. That is very insightful. And how do we create safe spaces in our communities? First in our homes, and then in our communities, the friendly spaces or friendly environments that can accommodate our people with dementia or Alzheimer's, or people with mental illness in general, and not stigmatize them. How do we do that as the community?
You know, there are some communities where, you know, they have initiatives where the ladies do a brisk walk together, you know, and some rural areas have adopted that, where, because it's an opportunity to engage, but you are also being watched, but you're getting exercise. Exercise is always good for the brain, you know. But also, I think the main thing is understanding that this person is losing their function and they're aware of it. When it's severe, the awareness is not the same, but to have that emotional support goes a long way as well.
Sure. And in the whole process of the degeneration of the neurons, the person becomes little, or they think like a small child. So in a way, we should treat them like the children, and maybe give them incentives if we have to. Like, for example, if they refuse to bath, can we incentivize that? We say, okay, when you finish bathing, we're gonna give you this, or when you finish bathing, we're gonna do puzzles or stuff like that. Does it help?
I think it depends on the stage that we're at, because if the mental processes are that you know, if that person has reached that stage, then it's okay. But, you know, if you do it sooner than when they've reached the stage where you need to incentivize, then it can create a negative sort of impression of where you think, you know what I mean, where you think the person is. So that's why it's so important to have a caregiver who knows you well, or who has access to somebody who knows you well, you know, because they know how far you can go at the time. But those incentives help, but you need to remember when it's at that late stage, there's a lot of emotions that are not properly processed in the brain. So and then it comes out as frustration. So the incentive is good because it simplifies things, you know. Like if you do this, then let's, you know, you do this. But you find at that time, the other component of dementia is that people then develop either no appetite or they will eat one particular thing every day, you know. So there is a lot of bargaining with taking care of someone with dementia anyway. So you bargain with them for them to finish their breakfast, you bargain with them for them to bath, that kind of thing. But there are times where you'll find that, you know what, it's not worth the fight. At least you ate today. We'll go over the bathing tomorrow. The other thing we need to consider is caregivers, and I don't know if I carry on. Caregivers and their stress, you know. So when we plan for taking care of the person, we need to also plan for that primary person to get relief. Because it's really strenuous to look after somebody with dementia on your own. So there are certain instances where because people presented early, they told you what their preference would be when things are, you know, happen later. Or if somebody has, you know, I have instances where somebody has several daughters.
Sure. And how can we find mechanisms or training to help caregivers to take care of their loved ones better?
You know, it's very, you know, caring for somebody who's sick is really difficult, you know, and caring for somebody whom you're expecting to get worse is also difficult. You know, it's difficult to keep your morale going under those circumstances. So I think early diagnosis is very important because then we get to know what your wishes are should things deteriorate, you know. So some people say to their children, like, you know what, I don't want to be a burden, take me to a care facility. And for some people, they think there's no way I'm going to take my parent to a place like that, you know. But you only understand, you know, later on how intense it is too. So I think with early planning, informing people that, you know, at some point, a person requires 24-hour round-the-clock, you know, care, because somebody needs to be aware if they wake up at night and go open doors or switch on taps and stuff like that, you know. So it's that, like, we need to manage our expectations as to what will happen, you know. And also to talk about this routine, you know, it will be different for different people because people are different in terms of what their interests are. And if something interests you, it's the last thing that will go, you know, in terms of deterioration. So to keep that engaged is very important. So I think early diagnosis planning and also understanding that the visual spatial aspect of it requires you to be in places that are familiar. You know, so if a person's going to be moved to a home, we need to do it as, you know, sooner than later because they need to go ideally when they're still aware of what their surroundings are, you know. But also to then apportion power of attorney and all of that to somebody else to care for your, for your financial and legal affairs. Very important, because what we have is we have families fighting at the last stage, and the person can't really give consent. We can't say that they are mentally able to do so. So I think a lot of pre-planning is needed, and I think for me, from the doctor's perspective, I really gained a lot of respect for carers when I was in that position. It requires a lot, and so I would think of it like I'm a doctor and I know medically what's happening. So imagine if a carer is somebody who is not medically trained, it's a family member. They need a lot of support, they need education, but they need to not be given the sole responsibility of taking care of this person, because it's a 24-hour job, So I think where we don't have resources for a day nurse and a night nurse, because there are caregivers who can come during the day and then one at night, where people don't have the resources for that, then the planning needs to be really intense and important as to what are we going to do when it gets there.
So let's bring it down to ekasi in our rural rural spaces. The reality is our family dynamics are broken, and you'll find that one person is solely responsible for a patient with dementia or Alzheimer's. So it's heartbreaking to even think about it. Hence, I was asking if we can develop mechanisms or solutions that can assist the caregivers, the trainings that can be administered to the caregivers in order for them not to burn out. Because they do burn out. And
No,
when they
absolutely.
do, it becomes chaotic because they end up abandoning everything. And you understand that there are also their children that they need to take care of, and the financial aspect of it as well.
No,
is
absolutely.
something else that we need to be discussed as well.
Yeah. Where I've seen it work is, unfortunately, in cases where the person who is ill has daughters. That's when I've seen it work, and then everybody then says it's our duty to do this, and they pick a week and they do it. So those are settings where I've seen this work, and where the caregiver then gets rest. But not everybody has that. Most of the time, families hire someone to look after, and it's the same person. And sometimes people hire them uzo cleaner and whatnot, and so we need to understand that you're actually looking after someone with dementia then requires, firstly, it can be the same person but all the time, but we need to then apportion certain hours for them to do that, and then they then have time for rest. And I think in an ideal setup, it would be really good to have these groups, for the caregivers themselves. Because it's really great. I learn a lot from what people tell me they do to try and manage the symptoms. Like, one of them is the bargaining, and the other is, sometimes people develop a preference from one person over the other, and, that kind of thing, and how that they can make it work for them. So I think, where things work well is where you anticipate, you have real knowledge of what it will be like. Because initially everybody says, yeah, I'll do it, it's my mother and whatnot. But when it gets hard, you find that everyone leaves someone to it, and they think if they've come at month end to give money, then they've done it. But people need to understand that it's a really difficult, with any disease, being the carer of someone, because a lot of the attention goes to the person. Nobody asks you, have you actually slept? Have you bathed today? Have you, you know what I mean? Like, have you done all the simple things that you need to do for yourself? So I think it would go a really long way. But what I've seen work in the rural environment is when the ladies get together, either it's a gardening. So you find that ekasi they have that as well, where ingadi yasesikolweni is used, and it's a group of people, they get there, they do it together. So that's a nice way of the person getting out and doing other activities, and somebody can take them there and wait, and then the caregiver can rest, type of thing. So there are several initiatives that people, when in the community, can get together for.
Yeah.
There's one now I've seen in a rural environment where the ladies go and play soccer. And that go and do that. Just that running around, kicking the ball, and all of that. But the sense of community that comes into it is very important. So it may not just be people with dementia who go there, but it's people who are at home and are not doing anything that are getting together and doing it. So I think it all needs to be tailor-made for the environment, and it's sad sometimes, being in private practice as I am, because you see how many options other people have, where some, people have access to occupational therapists, they have a day nurse, night nurse, and, it's like chalk and cheese sometimes, the kind of care that we're getting. And for conditions that are deemed incurable, like there are not a lot of people that are committing to them, And the caregiver burden is a lot as well on the health care practitioner, because sometimes people have, and it's done a lot to, government hospitals sometimes, where, I'm tired, we're going to drop this person off at a casualty or whatever and go, because now they must be admitted for a day or two or something like that. Family can't be reached. Somebody is burnt out, So that to prevent that kind of thing as well from happening, So the balance between giving someone you love the best care and you remaining strong enough to provide it needs to be there, and we need to manage those expectations. And unfortunately, when we are using the public health system, we need to provide that support for ourselves as a family and the community,
Sure. Yo, guys, now I've learned a lot. I don't know about you. We will take questions. We'll check. Do we have questions online? We don't have questions online. So we've got question in-house. We will take a question shortly. Before we go to a question, I still say it's our responsibility as the community to look after one another. And also, not to stigmatize people. It's very important that we educate ourselves. Platforms like this one is here for the community to be enlightened, to share the challenges and to share the strength as well. Because we're not only sharing the challenges, we're also sharing the strengths. Because someone else's challenges can be your strength. You can draw strength from someone else's challenge. So if we work together as the community and look after our people, they are our people after all. We cannot chase them away and take them out of our community. We cannot keep on stigmatizing them and labeling them as witches. We cannot go on like that. We cannot. And posting them on our social platforms and because there are also legal implications when we do that that we are not aware of. Okay. Can we take a question on the floor? All right. You can go ahead, sir. Okay. All right.
The Alzheimer's. Okay. Okay. Yes. Okay. Mm. Okay. So in terms of Alzheimer's, the first question, Papa, the Alzheimer's and what causes it. So Alzheimer's, there's that genetic predisposition, but basically what happens is there is an error, I'll call it an error, in production of an abnormal protein instead of a normal one, which would then cause cell death for the neurons, So it's basically cells that now are having abnormal cell processes, if that makes sense, and that kills the neurons. So with regards to the second one, with neurons they don't regenerate. So, and that's what makes the nervous system so precious. Like if I have a stroke in a certain part of the brain, it dies forever, But there is something called neuronal plasticity, which is something we refer to a lot with strokes, where if you engage the neurons that are still alive, you can create strong pathways that then can compensate. So certain people, for instance, I'll give a stroke example where then after extensive rehab, you get some improvement. It's because it's almost like trying to recruit the other live cells to try and take on some of the functioning of that, if I had to, put it simply. But you do not get dead cells back, but you can maximize the use of the current cells that remain, the brain cell. And so doing that is doing those cognitive exercises to, keep the mind engaged for as long as possible in the process. And it's difficult to give specific things to do there because, like I said, you need to know the person and their interests, level of education, what they were doing previously, that kind of thing. But also things like exercise, something simple like that can help with slowing down neurodegeneration because you create that environment where blood that is oxygenated is prioritized to the brain. So it's like giving, there's something that I like to speak on health or neuronal health, that how we can keep our neurons as sharp as possible with simple things, right? And one of them is exercise, and we undervalue what it can do for us. The other thing is maintaining risk factors. So if somebody has Alzheimer's and they have diabetes and hypertension as well, because a lot of the times you have that, if you can manage the other conditions better, then you the later stages, but also we can plan activities that then slow down the process, unlike presenting when already a person is hallucinating, and, then it's advanced. So those are the things that we need to invest in. Does that answer everything? Okay. Yeah. Yes, yeah. 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 Yes. Yeah. Hmm. Mm. Yeah. So the environment in which we are ill in makes a difference, in the sense that if we still keep on promoting health, it then brings us to brain health. If we watch what you eat, and and it's those things that are simple, then you can actually slow down the progression of a pre-existing neurological condition. And so sometimes it's found to be overly simplistic, but that's why I like to call it brain health, because it's the nervous system is precious in that sense that once you start losing the cells, it's inevitable, it's irreversible, and any means of trying to slow down that process is helpful, you know? So things that you see physically, like something with like Parkinson's disease, it has a dementia subset. But you will find that 2 or 3 of the same people with the same information, same age, but just the differences in managing the conditions. One progresses faster than the other, you know, with no clear explanation why, but it's just looking at the background of how people are maintaining health. And it's important for me to stress, because with dementia, we tend to lose hope, you know, because even the person, like then when they diagnose, it's very depressing, because you just think someday I would have lost my mind, literally, you know. So we lose hope early, and we then don't engage in the things that can at least assist us in prolonging that degeneration. Yeah.
So I can imagine watching yourself deteriorating, how painful and devastating that can be. And even for a caregiver, watching your mother or your father or your aunt or your gran deteriorating, it's something that the brain cannot fathom.
No, absolutely, it is. So that's the one thing that people don't, you know, while somebody's in early or, you know, moderate stages, they are aware of what is happening, you know. And a lot of the depression we then, you know, see is from that stage. And going on further, then you get a lot of confusion, psychosis, hallucinations, aggression, you know, that we need to manage. And we need to know beforehand that when we get to that stage, we'll need to do this treatment or not, you know. Like I said, you know, when I was in a position of having to take care of an ill loved one, it became even clearer how much it requires. And I have 4 daughters, and I was in a position where somebody is taking on a task, and then that felt definitely much lighter, you know, because then, you know, everybody knows what their role is, and the role is not everything. So, you know, as to what can we do, yes, the government owes us that, but it's not going to always happen then. So we can do it in our own households, where we say, okay, who's okay with doing this for Papa? Who's, you know, that kind of thing. And then it's better when it's collaborative.
Sure. And I can imagine it will be much easier if our loved ones are taken care of by ourselves than a total stranger.
Absolutely, absolutely. Although some people, you know, make the decision for their loved ones to say, I don't want to be a burden on you, put me in a home. But I think just emotionally, it's an easier experience for someone. But we need to also remember that it's not sustainable for one person to do it all the time.
Definitely.
You know, and it doesn't mean you love the person any less if you express it early on that, hey, this is hard work, you know. So I think the importance of just us then, if we have a loved one diagnosed, a few of us then have to come up and say, okay, this is what I'll do when the time comes. This is what, you know, I'll do. That way, I think it's not a mountain for one person to climb.
And do we maybe know how many care centers that we have in, say, for instance, in Pretoria, that are available and functional?
We really don't have dedicated, you know, dementia, you know, units. So in terms of healthcare and public healthcare, you get seen in a neurological division of the hospital, and there we're really just watching and prescribing medication for the symptoms then. So like I said, with the sundowning, the confusion and psychosis is there. Sometimes we need to give the person an antipsychotic, you know. So the role of the doctor is to see the stages and then give appropriate medication for the stages. But beyond that, then it's, it's the family and the carers then that need to then develop a routine for someone, see if they sleep, enough hours, are they eating better, have they changed that preference for food and whatnot, and then when that's reported to us, then we can give someone something for appetite, something for sleep, but the main component of the work that needs to be done falls on the family and the caregivers.
Sure. That is really sad to learn that we do not really have facilities that are functional and dedicated for people with Alzheimer's and dementia. It's really, really sad. And now, talking to the medical or medicine aspect of this, because there are many claims that our traditional healers can heal mental diseases, which I still need to see a patient that is fully cured from that aspect. So how do we blend, or how do we merge traditional meds or herbs and Western meds?
Sure, that's a good question. And I always say there's neurologists are in short supply, right? And we are in a country with 80% Black people, right? And there aren't a lot of neurologists to sort of meet that need.
How many neurologists do we have, by the way?
Now, probably close to 300 now.
Sure.
For the whole country. And probably 20% are Black neurologists. So what that taught me is it doesn't matter what my belief system is, but the fact that I have exposure to that kind of cultural thinking, then it means we need to have those talks up, with people who then believe this is a spiritual matter.
Yeah.
And my stance is always that I'm here to provide information for you to then make an informed decision, right? So my role as a neurologist is not to force this treatment down your throat or make you think that this is like, I speak a lot of neuroanatomy, the function of the brain, give information, and then the person decides. And the other thing I always say is that I'm not a spiritual leader, so I can't then say yes it is, no it's not. I think that's the like, personally I don't believe that would be the case, but it doesn't matter what I believe. If the family I'm dealing with believes that this is a spiritual matter, then my role is to provide information where we are making informed decisions, So if we lay out the pattern of what happens with dementia and what I can do as, in the form of prescribing appropriate medication, that's my role. And the fact that I'm in a position to culturally understand that kind of thinking, it means that I ought to then engage those kind of conversations, whether or not I believe it is, So I think that the one of the ways to face this is not to have the type of paternalistic medicine where the doctor says, therefore, where we are like, no, let's work together. I'll give you the information, and then you make that decision. As long as you are fully informed from the scientific way, and sometimes it just helps to know, it helps to know what are the statistics, what can I expect will happen, what's, you are knowledgeable and you can plan your own route in terms of health. But where also it's important is in protecting the people that wander, that are said to be witches. So we are in a position to then say, no, this is what happens with dementia, Then we're able to protect those people if we give that kind of information.
And should one person or a person encounter or meet someone who is who's now wondering what is it that they can do to protect themselves and the patient?
You know, when somebody's wondering, they have lost awareness, visuals of where they are in terms of space. You know, it's when that ability is taken away from you that you realize how important it is. That your brain is constantly registering. This is where you are. This is where you ought to be after this. So if you walk out your house and you wonder, then obviously it's very dangerous.
Yeah.
I think trying to forcefully take someone somewhere, it can be difficult because that person can be aggressive, frustrated, because they're scared, you know. Now, like, where am I? So sometimes it helps to sort of get help. Like if you can get a family member there, then there's a familiar face that then gets the person there. But in the meantime, some people just feel, okay, law enforcement, the police maybe can protect and wait, that kind of thing. But engaging the person doesn't always give you the results you want, because sometimes you do get that aggression because they're frustrated or they're hallucinating, you know. But I think to keep them in that space and get somebody who can help them is what will work. You know?
Because I've seen most of the people who were wondering were taken to the police stations. Now I've been asking myself, are the police trained or informed of the condition?
No, unfortunately not. And unfortunately, sometimes that's the only thing you can do is call the police, you know. It shouldn't be a burden that's on them. And I think that is a lot, that applies to a lot of mental health, even psychiatric conditions, you know, where the police are called on to handle somebody who's psychotic and they're not trained for that, and you know. So I think they are in a difficult position, but sometimes that's what people have, you know. Especially if it's somebody who's particularly being physically aggressive and all of that, it's a danger to other people.
Yeah, definitely. Sure. Man, this has been a very informative session.
Thank you.
I also learned a few things they knew I've never heard of them before, like vascular dementia. I'm going to research about it and learn more about it and explore on it. It's very critical, guys, for us to ensure that we empower ourselves with knowledge. It's very important. And as people who it can happen to anyone at any day.
Absolutely.
So it's important to be aware prior, so that you know, okay, when this happens, your brain will tell you, okay, this is that thing they spoke about that other day, then you know how to respond appropriately. And as families, if we have a family member who's got Alzheimer's or dementia, it's important to inform the neighbors. It's very important, because one moment you can have them with you, and one moment they can be wandering in the streets. And if your neighbors are aware of the situation, they can inform you quickly that, okay, your mother or your grandmother is wondering, please come and fetch her, or please send someone to come and fetch her.
Yeah.
It's very important to let the community know. Sure. That's why I mentioned earlier that it's important as the community to work together to take care of our people, because we cannot exclude them from our community.
Absolutely.
So in your departing point, please have a word on that.
I think if there's anything that I could say people need to remember is that, firstly, we need to, whether we're predisposed to